Everybody, welcome to St. David's. Thanks for coming. We're going to try to explain how to find out if you have heart disease. Now, in the old days, you used to get a stress test on a treadmill. But in order for a treadmill to be positive, you have to have 75% of the artery blocked with plaque. All right. Do you all know Tim Russert, who died last year? He had a stress test a month before he died suddenly. His nuclear stress test was normal. So he didn't have 75% blockage, right? But he probably did have about, let's say a soft plaque of 50% that broke up. And once it breaks up, then the body thinks it's bleeding and it completely closes off the artery. And you die suddenly because you don't get blood to the heart and it goes into ventricular fibrillation. That's sudden death. That's what this talk is about. It's about finding the vulnerable plaque. And basically all plaque is vulnerable to inflammation. That's what this disease is all about. It's about inflaming the arteries. That's what causes this disease. And many things inflame the arteries, like smoking, like stress at work. That's why people have heart attacks Monday morning going back to work. All the epinephrine and adrenaline causes their heart to get stressed. So you want to prevent inflammation by good lifestyle, because exercise cuts down inflammation. And also eating a bad, unhealthy diet will also cause some inflammation. But the thing that helps the most is probably a set of drugs called statins. And we'll get to that, because that helps the inflammation as well as lower the cholesterol. Okay? So, here's a normal artery, right? The lumen, there's nothing in it. Blood is flowing in and out, out very easily. When plaque starts to form, it forms in the wall. And so you can have plaque for a long time before it encroaches on the artery lumen. Okay? So when you could have plaque, get an angiogram, where they stick the catheter in your groin, shoot dye through your heart. You can have a totally normal angiogram and die the next day because this plaque ruptured. And that's been known to happen. Now, a calcium score, it will pick up the calcium that is laid down in the plaque. So Tim Russert, 10 years before he died, he had a calcium score of 200. And for his age, around 48, that put him in approximately the 90th percentile risk of having an event in 10 years. And sure enough, after 10 years, he had an event. So what I am trying to send you folks for is a coronary artery calcium score, a CAC. That's this test here. And we'll talk about these other tests. These are the 3 tests you need. And if we could get most people with at least one risk factor to have these tests before they get sick, I think we could prevent coronary disease, stroke, and heart attacks. Because we catch the disease early and we prevent the progression of the plaque by getting the cholesterol down low. Okay? So the reason you folks are here is you don't know if you have coronary artery disease, and we're going to send you to find out. Now, if you had a heart attack, well, then you'd have coronary artery disease. Lady in the back has a pacemaker. That's electrical. That has nothing to do with the coronary arteries, okay? But I believe she has atrial fibrillation also, so she cannot get the CAC. Instead, we will just send her for a CIMT. And this will show the plaque in the wall. It's just ultrasound. And we can see how thick the wall of the atheroma is, and from there determine her risk for a heart attack and stroke. Now, once we determine that you have disease, what we call subclinical atherosclerosis, because you don't have symptoms, then we find out what your cholesterol is. Now, you're all familiar with total cholesterol. In the old days, everybody went around, what's your total cholesterol? And they'd say, oh, it's low, it's 200. Oh, it's high, it's 300. And then we sprung something new on you. It was called LDL. L for lousy, or low, right? You want that cholesterol low. Then there's the good cholesterol we told you, HDL. H for high, you want it to be high, or happy, H for happy. Now we're telling you there's a new cholesterol. So keep up, ladies and gentlemen. You can do it, I know you can. It's called the particle number. So let me try to explain what that is. You've got a gallon of milk. That's one particle, 1 gallon. You pour it into 1,000 thimbles. That's 1,000 particles, okay? We are coming to realize that it's more predictive of whether you will have a heart attack based on your particles than it is on the total cholesterol, okay? I belong to the National Lipid Association, and as my mentor said this past weekend in Cincinnati, maybe we should call it the National Lipoprotein Association, because it's all about lipoproteins now. And the lipoproteins are not only LDL, but there's 2 other important ones called VLDL and IDL. And those are not measured when you get the LDL cholesterol. So I've been doing this particle number for at least a good year because Medicare started paying for it. And I can tell you that there's a tremendous discordance between what I thought I was treating with the LDL cholesterol and what I need to be treating with the LDL particle number. This number is much more accurate. Another name for this number is ApoB. Now they're going to have new guidelines probably early next year. And I'm hoping they will use this, but they probably won't. I think what they'll do is use something called the non-HDL cholesterol. Now it's getting complicated. Now it's really what it says it is. You take the total cholesterol, 200. You subtract the happy cholesterol, HDL, and you're left with the result. That's the non-HDL cholesterol. So your doctor right now not only should be getting your LDL cholesterol to either under 100 or under 70, but he should also be getting your non-HDL cholesterol to go. It gets awfully complicated, doesn't it? So that's why I say let's just use one number, this, because this is better than those 2 numbers combined, and this includes everything. And for this number, you want to get under 1,000 if you have high risk, and under 750 if you have very high risk. Now, how do you know if you're high risk or very high risk? Again, the guidelines are very complicated. So complicated. For example, family history is a major risk factor for heart disease. But most people don't realize that it's just first-degree relatives, which means your